You stretch your fingers. Pop. Bend your neck. Crack. It feels good, but is it damaging your joints or just harmless noise? Let's break the truth behind joint cracking. What's really causing the sound? Despite what your grandma said, that sound isn't your bones grinding. It's actually tiny gas bubbles collapsing inside your synovial fluid, the lubricant in your joints. When you move or stretch a joint, pressure changes trigger a pop, a harmless sound that resets after a few minutes. No bones are breaking. No cartilage is snapping. Is it harmful? For most people, nope. There's no solid scientific proof that cracking your knuckles leads to arthritis. In fact, multiple studies, including one where a doctor cracked his knuckles daily for 60 years, found no difference in joint health. But if cracking is painful, frequent, or comes with swelling or limited motion that's not normal, it could be a sign of ligament injury, joint dysfunction, or even early osteoarthritis. Should you stop? If it's pain-free and occasional, crack away. It's likely just a pressure release. But if it's compulsive, disruptive, or hurts, see a doctor or physical therapist. It's not about the sound. It's about what else is happening inside the joint. Because cracking isn't always a problem, but ignoring pain definitely is.